very special welcome to Chief Paul Wilders and Frank Chester of the Nassau County Fire Service Academy. Ms. Pia Miller from the Gold Foundation. Dr. Charlie Reardon, the Provost at Hofstra University. Ms. Jean Payton Christodoulou, the Senior Advisor and Chief of Staff to the President. Dr. Cornell Craig, the Vice President for Equity and Inclusion at Hofstra University. And Chandra Washington, Director of Community and Government Affairs to the President. And now I would like to invite President Poser to address the group.
Let me add my welcome to you to this white coat ceremony of the Donald and Barbara Zucker School of Medicine at Hofstra Northwell. I'm honored to participate in this momentous day, to congratulate all of you and your families and friends, and wish you all well on your next big step to becoming a physician. Let me just say that my name is particularly apt today, Susan Poser. I'm not a real doctor. I'm a doctor of jurisprudence and social policy, which is not going to help anybody having a heart attack or anything. But the dean wanted me to have a coat, so I have one. I also want to give a very special welcome to Dr. Stephen Tresiak, who will give the keynote address today. We're really honored to have him here with us. Today, the medical profession welcomes you into a noble community of service, a community that needs you right here at home and around the globe. In truth, as you sit there, you are actually already in this community as trained EMTs who have already cared for people in need. So you might say that we are actually welcoming you as colleagues. The EMT program is one thing that sets the Zucker School of Medicine apart as an extraordinary place to become a doctor, and you will experience many more, I promise you that. Today, you receive your white coat, a symbol of humanism, that healthcare is all about people and people in need. I was actually a classics major as an undergraduate, so I can tell you that one of several Latin words for white is candidus, which also gives us the word candor. So your coat symbolizes candor, truth-telling to your patients and in research. The white coat is, of course, a symbol with which we are all familiar, as it usually cloaks a doctor or a scientist. This new vestment will make you recognizable as someone who's highly educated in a career whose purpose is to care for others. And in all of these ways, this coat creates expectations and therefore confers responsibilities on you of the highest order. In a few moments, you will pledge to keep healthcare human and to care for your patients with dignity, compassion, empathy, and respect. As you take that oath, may you be encouraged and reassured by all of the people who surround you here today, as well as those who maybe could not be here in person, that you will be well supported in this journey. Along with your family members, friends, mentors, faculty, and peers, the entire community of Hofstra University is here to support you throughout this passage to becoming physicians. We are genuinely excited for you, excited to get to know you, and already very proud of you for getting to this moment in your lives. On behalf of Hofstra University, I congratulate you as physicians in training, and I look forward to following your progress and to seeing you around campus in the coming years. Thank you.
Thank you, President Poser, for your words and continued support. So I'd like to start by saying a few words about our white coat ceremony. And this year I'll keep my comments especially brief because our special guest, I assure you, will inspire you way more than I ever could. Many schools have their white coat ceremonies in the beginning of medical school and frequently in the very first few days or weeks. We take a somewhat different approach for a couple of reasons. First and foremost, we believe that this journey from entering student to physician is a transformative process. It takes time, nurturing, and there are sometimes bumps along the road in defining one's professional identity from person to professional. Second, our students don't even wear white coats in their early days. In fact, they wear EMT uniforms and have just recently completed their first course, CPR, which stands for Challenges, Privileges, and Responsibilities, and are now certified EMTs in the state of New York, thanks to the work of our faculty and our chiefs, Chester and Wilder, and the support. Hence, their transformation, as Dr. Poser has already said, I'm calling you doctor, has already begun, and we choose to acknowledge this at this time. We have a special treat today and are most fortunate to have as our guest to address our students, Dr. Stephen Tresiak, the Chair of Medicine and the Viner Endowed Professor at Cooper Medical School and Rowan University in Camden, New Jersey. I first learned of Dr. T, as he likes to be called, from my good friend and his colleague and co-author and CEO of the Cooper Medical Center, Dr. Anthony Mazzarelli, the Maz, as he likes to be called. So you have Dr. T and Maz. I think it's actually a New Jersey thing. But so several years ago, Maz sent me a copy of their book, Compassionomics, the revolutionary scientific evidence that caring makes a difference. And it was terrific, though I had never met Steve. Then sometime last year, at a Council of Deans meeting, Steve was the guest plenary presenter to the entire Council of Deans at the Association of American Medical Colleges. It was immediately clear to me that he would be the perfect person to address our students and faculty at our next white coat ceremony. I was thrilled when he accepted our invitation, and I have no doubt that you will be in agreement. A graduate of Notre Dame, he went on to the University of Wisconsin School of Medicine, subsequent training and fellowships in internal medicine, pulmonary and critical care, the University of Illinois in Rush. He's a specialist in intensive care medicine, a clinical researcher funded by the National Institutes of Health, more than 100 publications in the scientific literature, primarily in the area of resuscitation science. His publications have been featured in prominent medical journals such as the Journal of the American Medical Association, Circulation, the New England Journal, and his scientific support has been reaching from research grants from the American Heart Association, the NIH, the National Heart, Lung, and Blood Institute, where he serves as the principal investigator. But I think he's going to tell you a different story about his trail. So he and Maz are also the authors of a new book, Wonder Drug, and it's also outstanding. So as part of our celebration here today, every one of our students is receiving a copy of the book, Compassionomics, that he personally autographed. I want to thank him for arriving early and signing books for about an hour and a half. But now let me present him to you so that he can tell you his story and journey and message and about Compassionomics. So please join me in welcoming Dr. Steve Tresiak.
Dean Battinelli, President Poser, Dr. Reeves, faculty, students, families, guests, and our new inductees into the family of medicine, I thank you for the honor of sharing in this awesome day. Class of 2028, I start by congratulating you. You've worked hard, you sacrificed, you deserve to be here. The admissions committee at this school, they are experts in knowing what it takes. You have what it takes. They handpicked the 101 of you from nearly 5,000 applicants. You were selected to be here not only because of your academic record, but because of your personal attributes, your service to others, your resilience, and your compassion fit the ethos of this school. Of course, none of you have gotten here alone. You stand on the shoulders of those who have loved and supported you along the way. So today we also honor your families and all the people who have made this day possible. We're very grateful for them, and I know that they are very, very proud of you. Shortly, you'll receive your white coats. It formally marks your entry into the profession of medicine. Now, leading up to medical school, it's really been all about you, your studies, your achievements, your accolades. But when you put on your white coat, it takes a decisive turn. Instead of being all about you, it's about serving others, and it's about the primacy of the patient. It's not just a uniform. Your white coat is a responsibility. It's a responsibility to serve. Serving others is central to what this school and our profession is all about. Service to others is a principle that defines us. A cornerstone of caring for patients is compassion. Compassion is the emotional response to another's pain or suffering involving an authentic desire to help. It's distinctly different from a very closely related word, empathy. That's the sensing, feeling, detecting, and understanding component. But compassion goes beyond empathy because it involves taking responsive action. Now, empathy is absolutely vital because if we don't sense, detect, feel, and understand a person's struggle, we will miss 100% of the opportunities to respond with compassion. You can think of empathy as an antecedent to compassion, or more simply, empathy plus action equals compassion. So a few years back, my colleague and co-author, Dr. Anthony Mazzarelli, and I had a question and a hypothesis. The question was this: does compassion really matter? Is compassion just in the art of medicine, or are there also evidence-based effects belonging in the science of medicine? Is compassion just a nice to have with meaningful benefits, or are there also measurable ones as well? Does compassion belong in the evidence base of the science of medicine, and what is the evidence? So our hypothesis was this: compassion matters for patients, for patient care, and for those who care for patients. We hypothesize that compassion matters not just in meaningful ways, but in measurable ways. We analyzed over 1,000 scientific abstracts. There are over 280 original science research papers cited in the book that your school is gifting to you. Our conclusions from that work aren't what we think or feel. It's not what we believe. It's definitely not our opinion. It's just what we found in a journey through the scientific evidence. Now, I want to assure you of something. I don't have any magical thinking. No magical thinking. The most important determinant of clinical outcome is clinical excellence. The most important determinant of clinical outcome is clinical excellence. If you're a physician who prescribes the wrong medication or a surgeon who has a major technical error, there's no amount of compassion that's going to undo that. But don't fall into the trap. The trap is a false choice that it's an either or. It's not an either or. It's an and. It's clinical, technical excellence and compassion that gives our patients the best opportunity for the outcomes that they seek. There are more than 100 different papers published in the scientific literature on the benefits of compassion for patients, more than 20 distinct mechanisms of action. I'll start with the practical. So if you have compassion for patients, you may be more meticulous about their care, or have higher quality standards, or a lower likelihood of making a major medical or surgical error. Importantly, compassion for patients also improves self-care. That's how patients take care of themselves. The preponderance of evidence says this: if you care deeply about your patients and they know it, they're more likely to take their medicine. They're more likely to follow your treatment recommendations. They are less likely to be lost to follow-up. And there are also physiological effects of human connection. Compassion can buffer stress-mediated disease. It can modulate a patient's experience of pain. Human connection, or the lack of it, can modulate central nervous system and immune system function. Compassion for patients also has profound psychological effects, reducing patients' symptoms of depression, anxiety, and the psychological distress associated with serious somatic medical illness. Accordingly, Compassion is a powerful restorer of hope. Importantly, and don't miss this, compassion is a powerful beneficial therapy for the giver too. Science shows that compassion for others can have a direct beneficial effect on your own well-being. Neuroscience studies show that compassion for others triggers reward pathways in the brain and positive emotion that can buffer or even counteract the activation of stress pathways and negative emotion. In effect, compassion for others can get you out of your own head and make you forget your own worries, at least temporarily. And research shows that compassion for others can actually be protective against burnout. Why? Relationships. If you care deeply about patients, they know that and they feel that, you get the relationship that flows from that. And if you don't have that, all you have is a really stressful job. And so if it's one thing that Dr. Maz and I found in our work, it is this. The key to resilience is relationships. Compassion helps build relationships, and not just between doctors and their patients, but between colleagues or family and friends, anyone for that matter. And compassion, according to the published evidence, can be an antidote to burnout. In summary, after reviewing all the scientific data, I can tell you with confidence that compassion matters for patients, for patient care, and for those who care for patients. There is, in fact, science in the art of medicine, and the science is strong. Collectively, the data support that compassion belongs in the domain of evidence-based medicine. Now, class of 2028, here is my charge for you. You didn't know I was going to give you a charge, did you? But I am. I want you to commit yourself to getting better at compassion. I want you to commit yourself to growing in your compassion. That's right, get better. Just like you will commit yourself to learning the basic sciences and the clinical disciplines, I want you to commit yourself to getting better at compassion. Why? Because change is possible. That's not just some pithy platitude. It's actually a statement supported by rigorous scientific evidence. Research shows that empathy and compassionate behaviors can, in fact, be developed. And I admit that when I was sitting where you are, I didn't believe that. I mean, I used to think that people were either wired for compassion or they weren't, like something down deep in the fabric of who they were or in their DNA. It was a trait they were born with, so I thought. But the preponderance of published evidence in the scientific literature shows otherwise. My group recently published a systematic review of the 54 different studies that have tested compassion and empathy training programs for physicians. And of those, 75% moved the needle on compassionate behaviors, and many of those papers from the patient perspective. And the operative word is behaviors. We're not talking about what you think in your mind or you feel in your heart, but how we behave towards someone who is in need. The data support that compassionate behaviors are a collection of skills we must develop and practice, not a trait that we're born with. And if it's a collection of skills, we all can get better. But we have to believe that we can. Research supports that a growth mindset is essential. People who have a fixed mindset believe that compassion is a trait. Those people won't put in the work and they'll never get better. But people who have a growth mindset believe that compassionate behaviors are skills that they can improve on. Those people will put in the work and they will grow in their compassion, especially when compassion is hard. In closing, I want to talk to the class of 2028 about finding fulfillment. You're so talented. You all could have done anything you want, gone into any type of field and been wildly successful. If you just graduated from college, there might have been common themes at your commencement address, and those themes often go like this. Find your passion. Chase your dreams. Pursue your happiness. Your passion, your dreams, your happiness. News flash. That is actually terrible advice. It's terrible advice because in that mindset, it's all about you. And it would lead you to a life focused on serving yourself. But class of 2028, you heard a different call, a call to serve others. That's why you're here today. Abundant research shows that the way to fulfillment is not in serving yourself. Rather, the evidence-based way to live your life and to find true fulfillment is this. Ready? Ready? Find the greatest need that you possibly can, and then go fill that need. Find a need that's much bigger and more important than you are, and then dedicate the rest of your life to it in service to others. So let this white coat you're about to receive be your cloak of compassion, your ever-present reminder of the responsibility to serve, and the beginning of finding your true fulfillment. Thank you.
Thank you, Steve. I'll make sure I tell Maz that I'm not going to give that kind of advice anymore. So I've been straightened out. That was phenomenal and inspiring, and I'm sure it'll take us a long time to get to where we need to be, but we've professed the growth mindset from the beginnings, and it's really up to this faculty and others to help support these students to get to that spot. So thank you. So now we start our ceremony. Calling our students up so they can receive their white coats today will be Dr. Rona Waldenberg, our Associate Dean of Admissions, Dr. Nina Hicks, our Clinical Assistant Professor and award winner of the inaugural ICE Clinical Educator Award. Congratulations. Dr. Lindana Maras, Clinical Assistant Professor of Medicine and Science Education. Dr. Bill Rennie, Associate Professor of Science Education and Emergency Medicine. Coding the students will be Dr. Taranjeet Ahuja, the Director of Humanities and Medicine Curriculum, along with Dr. Carmen Rodriguez, the Faculty Advisor of the Gold Chapter. After receiving their coats, they will receive a pin from both the Gold Foundation representing humanism in medicine, as well as a pin representing their completion of the New York State EMT course from President Susan Poser. Dr. Ellen Perlman, our Associate Dean for Professionalism and Doctoring Skills, and Dr. Kathy Reeves, the Chair and CEO of the Gold Foundation, and we will all congratulate them before exiting the stage. We'll start with Dr. Waldenberg.
Okay, if we're ready to go. I actually like to call the group the entering class of 2024 rather than the class of 2028, because many of them will not finish in 2028. They will do PhDs, they will do additional degrees, they will do research years. So I'm just warning some of them, right? Times may change, that's for sure. Okay, so we'll start with Afsana Ahmed, Michelle Ackerman. Yvonne Andrade and Daniel Balin. Claire Blaufox and Rachel Breitbart. Kadim Brown, and Aliyah Brummel. Lane Carba and Gabriella Chin. Samantha Coates and Candler Cusado. Mariuxi Diaz Rodriguez and Samantha Dixon. Jake Doe and Dave Dotson. Sarah Ecker and Abube Emerson. Ethan Ertel and Lindsay Feinstein. Leanna Figueroa and Jordan Genesee. Ava Gomez Huggard and Emily Granicus. Thomas Guzman and Freda Hasselbring. And now I'm passing over to Dr. Hicks.
I'm in the right place for anything to happen, right? Hi, I'm Dr. Hicks. Thank you for having me. I'll continue on with our class today. We have Chloe Hiding and Grace Hiding. Sean Hilgendorf, Tyler John Horvath. Ashley Howe, Albert Shue. Sonia Jane Benjamin James. Karkarki Nilesh Karoti. Alexandra Kern Lily Cavey. Ishan Corona, Megan Kushner. Sahita Karkarni, Georgia Kerman. Justin Lamb, Caitlin Lee. Michael Lindsay Jr., Sebastian Leon. Noah Lee, Edward Hoklun Lee. And now I'll present Dr. Lindoa Marsat.
Hi, good afternoon, everyone. Next, I'd like to call Alex Luke Ariana Malik. Cynthia Martucci, Tanya Matthew. Brian McCann, Edward Moe. Isabella Molina, Natalie Montefer. Bisma Nasser Ni Wen. Ann Wen Atikana Nayama. Kavi O'Connor, Emily Orsino. AJ Pandina, Dana Platt. Ethan Register, Peter Wren. Hannah Ressinger, Nicholas Rios III. Hector Rivera Bermudez, Claudia Rodriguez. Christian Rodriguez, Kiana Rojas. And I'm going to pass the mic to Dr. Bill Rennie.
All right, we're going for the last group now. Ethan Royka and Evelyn Sandoval. Alexa Schechter and Chase Allen Ship. Sarah Siddiqui. And who else? Brett Silver, I'm sorry. Dimitri Strambakis, Tasfia Taj. Samia Tamazi and Rafina Tamboli. Isabella Tincher and Dejan Torrington. Neka Ulu and Bianca Vama. Greg Vitiello and Benjamin Jacob Weissman. George Dewey, Capri Wilbanks. And Kirsten Wohlers. Micah Wolfson, Crystal Wong. Sarah Wu, and Winnie Shu. Isaac Yang, and Young Jin Yoon. Joshua Zhang, and Karen Zhao.
So once more, let's have a round of applause and congratulations. And I'd like to invite up Dr. Samara Ginsberg, who's our Vice Dean and Dean for Medical Education, who's going to lead you through the oath.
All right, good afternoon. May I invite the class to please stand, as well as any physicians in the audience who would also like to join us in standing, and we will recite the oath together. I hope you are all ready to take on this awesome responsibility. Yes? Okay, the oath is inside the program, and we can join in together. I swear to fulfill, to the best of my ability and judgment, this covenant. I will respect the hard-won scientific gains of those physicians in whose steps I walk, and gladly share such knowledge as is mine with those who are to follow. I will apply for the benefit of the sick all measures that are required, avoiding those twin traps of overtreatment and therapeutic nihilism. I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drug. I will not be ashamed to say I know not, nor will I fail to call in my colleagues when the skills of another are needed for a patient's recovery. I will respect the privacy of my patients, for their problems are not disclosed to me that the world may know. Most especially must I tread with care in matters of life and death, and never abuse the power that has been bestowed upon me. I will remember that I do not treat a fever chart, a cancerous growth, but a sick human being whose illness may affect not only the person, but a family and community. I will prevent disease wherever I can, for prevention is preferable to cure. I will remember that I remain a member of society with special obligations to all my fellow human beings, those sound of mind and body, as well as the infirm. I will maintain the health of my own mind, body, and spirit, so I am able to discharge my duties appropriately. If I do not violate this oath, may I enjoy life and art, respected while I live, and remembered with affection thereafter. May I always act so as to preserve the finest traditions of my calling, and may I long experience the joy of healing those who seek my help. Congratulations.
So we're privileged not only to have our special guest, Dr. Trisiak, but Dr. Kathy Reeves, who's the president and the CEO of the Gold Foundation. I'd like her to come up and also address you.
Thank you, David. So first, I want to offer my congratulations as well. But more importantly, I want to thank you. I want to thank you for your commitment to compassion, to trustworthiness, and to humanism. And I want to share a secret. the white coat ceremony really isn't about the white coat. The white coat ceremony is about that oath you just read. The purpose of the white coat is to remind you that you read it. Every time you wear it, every time you see it. And I'm going to share another piece of science with you that's going to help you keep your oath. Dr. T shared with you the science behind compassion. There is also science behind habit. You are going to form habits, whether you intend to form them or not. I'm going to ask you to intentionally form them. You're at a very, very special place. There aren't many schools like this. There aren't schools where I make sure I'm at every one of their white coat ceremonies. The Zucker School of Medicine is built on humanism. So learn from these folks. Learn compassion, learn trustworthiness, learn humanism. The reason we have you take an oath is because Arnold Gold and his wife, Dr. Sandra Gold, who started the foundation, thought graduation was too late. So now you're already committed. And I just want to offer a small bit of practical advice to all that you're going to learn from this amazing faculty. First and foremost, even though we often say don't do this, I want you to always make one assumption. And I want that assumption to be your patient wants to be healthy. Parents want their children to be healthy. Children want their parents to be healthy. Enter every encounter that you're privileged to take part in that way. Second, I want you to create connection as your priority with every person that you see, not with the computer, not with the electronic medical record, but with the patient. And then finally, if you're gonna create connection, then you have to be well. Dr. T talked about how compassion will make you well. Wellness will also make you compassionate. And in that line, every time before you enter a room, I want you to take a minute, breathe in, hold it for 4 seconds, and breathe out for 6. And say, that person in that room has to be the most important person to me. Congratulations, thank you. I believe the future of medicine is secure, and I'm excited to see what you will do. And please be grateful to the wonderful people in this room and to the wonderful people who are going to teach you. Congratulations.
Okay, almost ready. So now for the most important part of the entire day, I'd like the students to all please stand up and turn around into your sides and thank all those people who were here today to support you. So congratulations, everyone. Congratulations on the ceremony, on the journey that you're on, from person to professional to compassionate, humanistic, and technically proficient, excellent professionals. So I'd like to ask everybody to please remain in your seats until all the students have proceeded out, and then you can meet in the lobby and outside, and then I invite everyone back to the School of Medicine for a celebration this afternoon. Again, congratulations.